Dr. Albert Sedo here is a specialist psychiatrist at the Kolebu Teaching Hospital and joins us via Zoom for a conversation on this. Good evening, Doc, and thank you for joining us on News 360. You would agree with me that it has become alarming the way the youth abuses opioids in recent times. But from where you sit as an expert, how serious is the situation?
It's very, very alarming. So somebody might ask, why do they use it? Even though sometimes they get to find out that it's not that good for them. The main reason why they start using it is because of how the drug works. So the active ingredient in there is high-dose Tramadol. And it's an opioid. It's a synthetic opioid, which means that it is specifically made from the lab to serve a particular purpose. And it has a sedating effect. Okay, so, but when they take it, they feel euphoric. So the feeling of euphoria is what makes them want to continue using. Also, they use it especially among the manual laborers, the manual laborers, because they want to work harder, longer. And some of them also use it to suppress their hunger. They notice when they take it, they don't have to eat much. Or some also say it prolongs their sexual activity. You know, those are some of the reasons why they normally use it. For other people, elderly and co, they may start using it by prescription from the hospital with the approved dose, that's 50 milligram or 100 milligram. And then when their system becomes used to it, then they go to the black market to acquire the illegal ones. So it can be iatrogenic. That is, say, a doctor prescribed Tramadol for you to use, and after some time, your body becomes used to it. That is tolerance. So you will then need a higher dose to achieve the same effect. It could be that you are in pain and it was prescribed for you. Now, because you need a higher dose, and the doctors will not continue to give you higher doses because we know the health implications, they mostly go into the black market. That is highly, highly welcoming to them to acquire the illegal ones. For the youth that we are focusing on, most of them use it because of the euphoria and because it helps them supposedly to work harder, longer. It suppresses their hunger and as well sometimes increase their sexual libido. That is the immediate temporary benefit they get that they have. What happens is the drug works by releasing dopamine. It's a pleasure and motivation chemical in our brain, and that's what makes you feel good and want to do something again. Now, using it for a long time shuts down your natural production of that chemical, that's the dopamine. Dopamine is naturally released into our system when you drink water, you eat, you socialize with people, you have sex, or you do things that are normally pleasuring. That dopamine is released at a normal level. But when you take substances of abuse, in fact, all substances of abuse works by releasing very higher doses of dopamine. Now, over time, that reward system is shut down so that you now prefer to use the drugs to increase the dopamine rather. So it takes over your life. So you prefer to rather take the drug than eat, socialize, do things that are activities of daily living. So that is why it's become alarming.
Doc, you have mentioned some of the effects of using this drug for a long time. But help us also understand what health experts can do to prevent the abuse of this drug. You mentioned that some of these people go to the black market, but we're also told that others go to the pharmacies to get these drugs without prescriptions. How can health experts help prevent this?
So primary prevention is we hope that people don't become addicted to it or become dependent. That's the primary prevention. So the first way to go is public awareness, just like this medium, where people need to know that prolonged use of this drug has a high risk of addiction and dependence. It has a high risk of weakening your immune system. It has a high risk of liver and kidney damage. It has a high risk of respiratory depression, so you can die from overdose. Once they know some of these things, there's high risk of your brain getting damaged and cognitive decline, which means your memory, your decision-making, your impulse control all be messed up. So once you know these are the negative effects it's likely to have on you, you are not likely to want to even start it because nobody starts out to want to become a junkie. So the awareness creation, people need to know how bad it can affect them. Once they know it, chances are that they are not likely to use it. That's a primary. But when they are already in it, addiction is now known as a chronic brain disorder. because they start using it impulsively, but they continue using it because of compulsion. So they are forced to use it. Because when they stop, they have withdrawal effects. The withdrawal effects include pain problems, vomiting, diarrhea. All this causes them to want to go back to use. They feel uncomfortable, they become agitated, irritable. So they want to go back to use to feel okay. So they continue using, not because they want to continue using necessarily, but because they have to.
Right.
Somehow function okay. So now when they know these things, they're not likely to want to go start using it. Now, if those who are already dependent on the Red-225 or any other substance of abuse, the medical people, we come in to do what we call detoxification, where you are admitted in the hospital for about 7 to 10 days, and we help you flush the drug out of your system in a way, and also avert any possible withdrawal effect by giving appropriate medications. From there, we then have to get you into rehabilitation. The rehabilitation, we have two types. We have the residential rehabilitation and the OPD rehabilitation. Now, the tertiary prevention is where any complication that may be arising out of the dependence on the drug is treated appropriately. Occupational therapists come in, psychologists come in, social workers come in. So that is how we are able to help. But the key among them is the public awareness.
Right.
So people know how bad it can affect them, especially respiratory depression that can lead to death, like the guy was saying in the video.
Right, Doc. I'm sure that we'll continue this conversation very, very soon, because this is such a worrying situation we're all hoping we find a solution to, and soon. Thank you so much for those insights. Dr. Albert Sedo here is a specialist psychiatrist at the Korle Bu Teaching Hospital.